Okay, this video is the last video on the digestive system, and we're going to look at 4 different digestive disorders or diseases. Okay, so these are problems with parts of your digestive system. We are going to talk first about cirrhosis. Cirrhosis is a disorder of the liver, and your liver has so many important jobs. One of them is to make bile to help you digest fat. But the other big job that the liver does is the liver is like a big filter that detoxes your your blood. So if you have any sort of medication you take, it will break it down. Um, and it will also break down toxic things like alcohol. So people who ingest too much alcohol, they really make their liver work hard, and sometimes they can damage their liver if there is more toxins than the liver can handle, and they develop scar tissue, and it prevents the liver from functioning properly. Um, so remember how we said the liver can break down, uh, can make bile, which breaks down fat, okay, and it can break down unwanted, like toxic and waste products in the body. So, people who have cirrhosis, they can't digest fat well, and they also have trouble breaking down um, waste products and toxins in the body. You know how there are detox diets out there? You don't need those. Your liver does that, and it doesn't need a special diet to help. But if you damage the liver, you prevent your body from naturally detoxing. So, um, there are a few causes of cirrhosis, right? You could have a very fatty liver because, you have an improper diet, or you can drink a lot of alcohol. You could have alcoholism that causes cirrhosis, or you could have a infection like hepatitis. Hepatitis C is a virus that infects your liver and causes scar tissue as well. If you have cirrhosis, you'll have some symptoms, including fatigue, so you'll be tired, nausea, abdominal pain, yellow or itchy skin, and fever. So the fever is related to if it's a virus. Okay. The yellow or itchy skin is a condition called jaundice. Jaundice is a disorder caused by your liver not breaking down a substance called bilirubin. Bilirubin is, I think this is how you spell it. Bilirubin is a substance that is like a waste product of old broken down cells, and your liver breaks it down and allows you to remove it from your body. And so if your liver's not working, the substance doesn't get broken down and it has sort of a yellowy orange color. So people with liver disorders, their skin turns yellow, and that's called jaundice. If you see someone you know in your family and you notice that their skin is getting yellower, they need to go to the hospital because there's something very wrong with their liver. And the fatigue, nausea, and abdominal pain are a consequence of digestion not going correctly because there's no bile. And if the doctor suspects you or a family member might have cirrhosis, they will do blood tests to assess the liver function. So they'll be looking for bilirubin and a lot of the other things that the liver is supposed to break down. And if there's a lot of them, then they'll realize that your liver's not working well. You can have a CT scan or an ultrasound to examine the liver's condition and look for scar tissue or abnormalities. And you can get a biopsy to look for the scarring. Um, if you have cirrhosis, your treatment includes uh, the diagnosis and treatment of underlying diseases like hepatitis C, medication to reduce the symptoms. So you'll have medication that sort of helps you do the liver's function. If you have severe cirrhosis, you may require a liver transplant. Liver transplants aren't that bad because the liver will actually regenerate itself. So you only need a small piece of liver, and that piece of liver will be able to grow into a big liver, which means you can be a liver donor and only donate part of your liver to another person, and then your liver will grow back and their liver will grow back. To prevent cirrhosis, drink less alcohol and treat any underlying causes. Gallstones are small pebble-like masses that are found in the gallbladder. Remember, the gallbladder holds your bile. The stones may be as tiny as a grain of sand or as large as a golf ball. Small gallstones often don't cause symptoms. So you may have gallstones in your gallbladder right now and not know it. But if they get larger, they can prevent the bile from leaving your gallbladder and it will swell up and you will be in a lot of pain. So, large stones can cause upper abdominal pain, fever, and yellow skin or eyes, right? The yellow skin and eyes is because the whatever has impacted your gallstones has probably also impacted your liver. To detect gallstones, you can have a CT scan or an ultrasound to detect the gallstones. And a scan that uses radioactive material can show a blocked bile duct. If you need your gallstones treated, you can take medications that break down the gallstones, or they can use ultrasound vibrations to break down small gallstones. So they'll play a wave of sound that we can't hear that is very high energy and it breaks um, the crystal that is your gallstone down. Kind of like if you've ever seen, they have that bit sometimes on television or in movies where an opera singer sings and it sings at the right frequency and the glass breaks. That's sort of like that, but as a medical treatment. Prevention of gallstones. So you can reduce the risk by maintaining a healthy weight, a healthy diet, and a healthy lifestyle. Ulcers. Ulcers are a painful sore that forms when the lining of the stomach or small intestine breaks down and tissues are exposed to stomach acid. So we have this mucus that protects our stomach and maybe a little bit of our large intestine. And there is a bacteria called H. pylori, which interferes with our mucus lining. So if you have a lot of this bacteria in your stomach, it can prevent the mucus lining from forming correctly. And then the stomach acid will have direct access to your stomach cells. And stomach cells are made out of the same thing that meat is made out of, right? And your stomach breaks down proteins, breaks down meat. So the stomach will break down itself. Uh, Other risk factors for having an ulcer include smoking, alcoholism, medication, radiation, and stress. So people who are going through chemotherapy, for example, sometimes they develop ulcers, or people who are taking certain medications, they prevent the mucus from forming and they get an ulcer. Symptoms of an ulcer include a dull or burning stomach pain, weight loss, loss of appetite, nausea, and blood when you poop, bloody feces, and sometimes bloody vomit. If you suspect you have an ulcer and you go to the doctor, they will check for blood in your feces samples. So they might ask you to give a sample of your poop and check for infection of H. pylori and also blood. And they might do an endoscope. So they will stick a camera up your rear end on a long flexible tube, and well, so they can stick it down your throat, and into your stomach that way, or they can, if they're looking for something in your intestines, they can stick it up your anus and look at your intestines that way. So this is to find the location of the ulcer, so they can see if maybe you need surgery to close the ulcer. So treatment, ulcers are caused by the bacterium are treated with antibiotics. So you might take an antibiotic to kill the H. pylori bacteria. Medications that decrease the production of stomach acid may be used, right? So that your stomach acid isn't eating through your stomach. And ulcers that bleed a lot may require surgery. To prevent ulcers, don't smoke, limit alcohol, avoid the medications that cause ulcers, such as aspirin. So, a lot of painkillers are very rough on your stomach and they prevent the mucus lining from forming. So, people who take aspirin a lot sometimes develop ulcers. Finally, we have lactose intolerance. Um, if you have lactose intolerance, the enzyme that is required to digest lactose, which is a sugar in milk and dairy products, is not produced or the production is too low. This can be genetic or it could be caused by an infection. If you have lactose intolerance, you will know because when you eat dairy food, you have a lot of symptoms such as gas, bloating. We talked about, remember how if you don't break down the lactose, the bacteria in your large intestine do, and they produce that methane gas, right? That makes you bloated. You can have an irritated large intestine because, once again, all of the bacteria are breaking down the lactose that you're not breaking down, and they cause problems and because they live in your large intestine. Um, and the large intestine is also responsible for removing water from your food, absorbing water. So if it's not working because it's irritated, it doesn't absorb the water, and then you get diarrhea. Cramping is due to the irritation of the large intestine by the bacteria, and nausea is, you know, sort of associated with the same thing. So all of those symptoms after you drink milk or dairy. How is lactose intolerance detected? Usually it's diagnosed from a person's description of symptoms and diet log. So if every time you have dairy you get sick, they know you have lactose intolerance. There's also a breath test that measures the production of gas by the bacteria. So if you have a lot of methane in your breath, they can detect it and, assume that you have some sort of digestive disorder. For treatment, you can take the lactase, the enzyme that breaks down lactose, orally. So there's a pill. You can take a pill of lactose, or you can consume lactose-free dairy. This dairy has the enzymes already added, and the lactose has already been broken down by those enzymes. Or you could eat and drink dairy alternatives like soy and nut milk and vegan cheese. Um, if your lactose intolerance is genetic, you cannot prevent it. Okay. So those are four of the digestive system disorders. Okay. There further a little bit on digestive health. There are some symptoms that you, of course, usually look for when you are looking at digestive health, right? So you can have constipation. Constipation is when you pass your feces less frequently and with more difficulty. So they're a little bit more solid and difficult to push out. Or you can have the opposite is diarrhea. This is a condition when feces is liquid instead of solid. And usually both of these are an indication that something is wrong with your large intestine, or maybe your small intestine. Okay. There are some medical procedures that you might have to go through if you're having regular problems with your digestive system. One is a barium swallow. This is interesting. So they will have you fast for a couple days, and then you'll go into the doctor's office and they will have you drink this chalky, gross liquid. And this will show, uh, on an X-ray you can see where the barium goes, and it'll like look for defects or holes in your esophagus, stomach, and intestines. Okay, and so it will allow you to diagnose things like ulcers, cancer, and polyps. Polyps are non-cancerous growths, so um, there might be bumps in your digestive system. There's a gastroscopy a- or a gastroscopy. It's an endoscope that passes through the mouth and into the stomach, the esophagus and stomach, right? So this is good for ulcers of the stomach. It's good for acid reflux, right? To see the damage caused by the acid on your stomach and your esophagus. There is a colonoscopy, which is the endoscope that is passed through the anus, the other end of the digestive system, and into the large intestine. They don't use the same camera. It's a different camera, and they clean it obviously very well um, in between different patients. If you have a colonoscopy, they can find damaged tissues in your large intestine. They can look for cancer. They can look for ulcers in your intestines, and they can look for intestinal bleeding. Biopsy is when they cut a sample of tissue from anywhere in your body and they examine it under the microscope. They can do that for liver to see if you have liver damage, like cirrhosis. They can do that for ulcers. They can also do it if they think you might have cancer. There's a 24-hour pH study. This is usually if they suspect you have acid reflux. So acid reflux, you know that their stomach acid, and at the top and the bottom of your stomach are sphincters, which are muscles that keep everything where it's supposed to be. So you have a sphincter at the top of your stomach that keeps acid from going up into your throat, and you have a sphincter at the bottom of your stomach that allows you to slowly bring in that partially digested food into your small intestine. Acid reflux happens when the sphincter at the top of your stomach doesn't work well. So people whose top stomach sphincter is not working well, what's going to happen is the acid is going to go into their esophagus, and your mucus lining isn't as good in your esophagus, so it's going to cause heartburn, right? Um, and so when they're testing to see if you have acid reflux, they put a tube in your esophagus through your nose, and it checks the pH constantly in your esophagus over 24 hours. And if the pH is too low, if it's too acidic, then they figure out that you have acid reflux. There's also blood tests. Blood tests are there to detect enzymes. So it'll tell you if you have the right amount of lactose, for example. Or they can test your blood for chemicals so they can find out, for example, if you have hepatitis C that's causing your cirrhosis. So you can use blood tests usually are for liver, pancreas, and gallbladder problems. Okay, so that's it for the entire unit. For homework, okay, we have some digestive system worksheets that can help you, you know, learn some of this material. And then there is a digestive system there's a digestive system quiz to take. What might make the quiz a little bit easier? I used to make this a an assignment for people, but what might make the test easier is if you go to Explore Learning, and there is a digestive system gizmo, right? Time might be tight for you, so I can understand if you just want to try it without the gizmo, but if you need a little bit of something extra to help you understand the digestive system, there is a gizmo down here on the digestive system. It's fun to do. You can make your own digestive system and then you can feed it food. And you can, of course, get the instructions for the gizmo here if you're interested in it. Maybe I'll link a sheet. Again, you don't have to do this, but one of the nice things, if it would bother loading, come on, come on, Gizmo. Okay, it will show you the different parts of the digestive system. And if you click on them, it'll explain what each part does. And then you can arrange them into your own digestive system. And then you can feed it food. And you can see how much of the different, like fats, proteins, and carbohydrates, how much of the different nutrients get absorbed by your own digestive system that you created. And it will show you um, what the poop looks like on the other side, right? So if you assemble your digestive system wrong, you'll get like sometimes diarrhea and sometimes constipation. It's really cool if you have time and you want to play around with it. Although not really selling it well if it won't load. Okay, so that's one way you can play with your digestive system. All of the pictures on the quiz are from this digestive system gizmo, and basically most of the definitions. So, if you want an easy quiz, there you go. And that's it for the digestive system, and that's it for the animal anatomy of mammals unit. So I will post a review for this unit, and then um, there will be a test tomorrow, and then a new unit Friday, or a new unit. Well, it might not be Friday. When I'm recording this, it's Friday. There will be a new unit, our last unit, the day after the test.